We're bringing our long list of speakers to a close for today with the next two speakers who come to us from Cassette Health. Dr. Reeves and his companion are going to come out here and pick up the conversation that we started earlier in the day. You'll remember, early in the day, I flagged for you this important word, disruption. And we've heard about all the different industries that have been and will continue to be disrupted by digital technology. Well, the time is to do something about our health system. In most people's lives, there are two primary issues: financial security, health and wellness. They jockey back and forth for positions 1 and 2. If you check out the cost of health to the National Exchequer, you'll see that it's creeping close to 50% of the overall budget, and nobody is ever quite fully satisfied. So something has to be done, and John Reeves is going to tell us what that is. How are you, John? And you're?
Aaron.
Dignan?
Yeah. Dignan, yeah.
Dignan.
Good to see you.
Ever, bring your teenage daughter to IdeaCity. I've been bringing Alexander here for the past 4 or 5 years. Who does she meet? Jack Andraka, okay? Breath test for pancreatic cancer. Next year, Laura Decker, 14-year-old, sails around the world. Because when you call her and tell her that you'll be speaking at IdeaCity, you better be prepared. That's what you get. Does that mean they'll be reducing ticket prices? Well, Alexandra, no. Because today, speaking with me, I brought Aaron Dignan. And Aaron Dignan is a global rock star when it comes to business disruption. So Aaron will talk first, and I'll follow up afterwards.
All right. So I recently became a vegetarian who sleeps 8 hours a night and journals. So I have to throw that speech right out. What I'd like to talk about is, well, actually, I'd like to start with a party trick. So I'll do some mind reading. How many people here work or have worked in an organization? Okay, good. So I'm reading your mind. First thing, our organization struggles to keep up with the pace of change. Every country I go to, every CEO, every executive, every team I talk to, we hear this theme. We're struggling with the rate of change now. The rate of change is so extreme. There's so much tumult and volatility and technology. What do we do about it? That's one thing we hear. Second thing we hear is we're overwhelmed by our own complexity. We are so big as organizations, and I don't care whether you're 1,000 people or 500 people or 500,000 people, it's just so big. How do you make sense of it? How do you collaborate? How do you not have silos? How do you not have divisions and people at war with each other? How do you know who to call, right? We all have that issue. And then the meetings and the emails and the text messages and the Slack messages, it all starts to overwhelm us. And then the third thing that I hear over and over again is that the culture we create, almost accidentally, the rules, the process, the restrictions, actually turn our top people off. They turn us off. And they turn off the people that we want to attract. And so when people start talking about digital disruption and we want to shape the industry, we want to change things, they start talking about, we have to hire some of those people, some of those millennials or some of those Silicon Valley people or some of those people from Google, because there's something going on here and we have to attract them. How do we attract them, right? And what I really want to get across that we've found after interviewing countless firms is that it's not you and it's not your people. The common excuse of, like, we need different people, that's not what it is. It's the operating system. It's the operating system. And what do I mean by that? It's pretty straightforward. Every organization has at its core a set of simple rules about how it works, how it functions, how it structures the work, how people collaborate, that add up, that emerge into a culture, that emerge into a way of working. And that could be operations, that could be structural, that could be informational. Do we believe in transparency or not? It could be authority. Who is allowed to make decisions, and how do we make decisions, right? When these things start to commingle and interact with each other, and you build a culture on top of them, you could get a Google, or you could get a Kodak. And it's completely based in the deeply held beliefs and assumptions that we have. Now, what's wrong with our OS as a culture? And this is true at a macro system level when we look at healthcare, and it's true when we look at a single organization in that system. What's wrong with our OS? I'm going to start with a pop quiz. What year is this from? Might be a trick question, might not. What year is this from? 92. 80, 88. Do I hear a 90? All right. 2016. Okay, here's when it's actually from. 1920. Now, if I showed you a car, or a shoe, or a dress, or an airplane, or a building from 1920 and said, what year is this from? Everybody would say, looks pretty old, maybe Depression era, maybe a little bit older than that, swinging 20, they would know that it's old. But I show you the main visualization of how we structure our work and our organizations, where we spend at least half of our lives, and we're all like, it's kind of indistinguishable from when people used to use horses to get around. Right? This is a crisis. It's a huge problem because it means that we haven't evolved how we think about how we do our most important work. And so the world has changed, but we haven't changed. The world has become complex, interconnected, global, high dynamics, rapid rate of change, but we haven't changed. We have better access, more technology, right? Billions of people have a device in their pocket more powerful than what took us to the moon, and they use it to look at cat pictures. Right? We just have excess power. We have platforms that we can build on, whether it's Google or the Apple Store, or the Amazon Web Services. We can build things over a weekend that are incredibly powerful. And we have networks like never before, whether it's Facebook, whether it's LinkedIn, whether it's Internet of Things. We've also got some downsides. More competition. Because it's so easy, more firms can get started up. We can have disruption from the outside or disruption from the inside. There's more money going into blockchain in the last 6 months than the GDP of a small nation. We're all getting so many bites at the apple. And the second thing we're seeing is more information. It's an onslaught. It's that overload that we're used to. And finally, more volatility. It's changing faster. You don't know what'll happen. Gas prices can change in Saudi, and suddenly world currencies are destabilized. Everything's interconnected, and we don't know how it will unfold, right? It's like trying to control the weather. And so we need a new OS. We need a new OS. We need a new way of working, a new way of structuring what we do, a new way of innovating and disrupting that starts at the ground level. And there are companies out there that you can spend time looking at. We don't have time today, but that are really, really moving the needle forward. W.L. Gore or Buurtzorg even, in the healthcare category, in the nursing industry in the Netherlands, or Valve, where the job descriptions only have 2 bullet points. Bullet point 1, go find other great people like you to work here. Bullet point 2, your desk has wheels on it, go find something to do. That's the job description of all 400 people that work there. They make billions of dollars every year. So there's a lot of change happening to empower employees, to build self-organizing, dynamic, self-managing systems that don't have all the bureaucracy and hierarchy and command and control chaos of before. And so we need to move in that direction. And what I want to ask you guys to think about as we're moving through the rest of the talk, as we hear from Dr. John, is where do you stand, right? When you think about your organization, your way of working, your way of thinking, are you designing for efficiency? For command and control, for centralization, for risk aversion? Or are you designing for adaptivity, to be self-managed, to be decentralized, to be responsive and entrepreneurial? And what does that mean for how you show up at work? Because really, how we show up as individuals is how we make teams, how teams operate is how we make organizations, and organizations change and shape the world that we live in. Now, I know a lot of you are thinking, but Aaron, healthcare is different. We have excuses and reasons and complexities that you don't understand, and so for that reason, we can't do all that stuff. We can't rethink how we work. We can't empower. We can't experiment. We can't, make change. And to that, I basically say yes and no. And for the no part, I'm going to hand the key over to Dr. John Reeves.
Okay, so let's start by taking a look at the digital healthcare landscape. Okay, so nowadays, each one of you has access to more medical information than ever before. Right? Each one of you has access to more information than I ever had when I went to medical school, or even when I practiced medicine, or even afterwards, right? It's all at your fingertips. Okay, we all have access now to online medical consultations, 24/7, on demand, when you want it. Correct? It's out there. And today's technology even allows you to triage yourself to determine whether or not you should actually go and see your physician. All great stuff, right? So just like in other industries, these disruptions that we're seeing have come from outsiders, not from inside the ecosystem. But what is consistent is an approach they take. That's the patient pathway you're seeing up there. It's actually quite complex. It's longitudinal and takes place over a patient's lifespan. But disruptors in other industries come in and they find that one pain point, and they solve that one pain point. So take, for example, Airbnb and booking lodging, okay? Or if you're looking at Uber to get your taxi. So these outside disruptors can come in, find that one pain point, and resolve it. But in healthcare, it's not that simple. Solutions that we see tend to address pain points, but they're not connected. What's more important is they're not connected into that large, very complex healthcare ecosystem. And if that data and information is not flowing into the ecosystem, it means that your doctor, your pharmacist, your nurse, they're not getting that information. Therefore, they can't course correct. They can't change the quality of the diagnosis. They can't change the quality of the treatment plan, and they can't manage you afterwards. So the question really is, are these disruptions that are taking place from outside leading to better healthcare? Or do they really just harm the critical doctor-patient relationship? So let's go back to those three examples. Google, Dr. Google. Who here uses the internet for healthcare research? All of us, right? Okay. Is it good or bad? So as a physician, when patients show up in your office with stacks of information, right, the hypochondriacs, okay, how much time as a physician do you think you have to spend to erase the bad information before you can actually put the good information in? In this case, I showed a search for Prestige, an antidepressant. So when a patient leaves your office with that prescription, what's the first thing they're going to do? 80% of patients are going online. And the information they're going to get is probably not going to support your treatment plan. They're going to be reading about the side effects, the pineapple that will grow on the side of their head, which means they're not going to start the medication, which means you will not get product start, you will not get adherence, and you will not get great outcome. This is where it's brought us. 32% of Americans now think that they could be doctors with little or no training. Okay, now let's look at that telehealth model. Okay, so here's a research study coming out of, I think it came out of Stanford, which showed that telehealth probably isn't as great as we think it is. Okay, so taking a picture of a lesion, sending it off to a doctor online, having them diagnose that, and make a decision for you and tell you what to do isn't perfect. In this case, they found out that 20% of melanomas malignant were actually not diagnosed, and these patients were sent home, told it was okay. And this is great. This is last week coming out of the UK, out of a company called Babylon. They actually pitted doctors against a robot, okay, against a machine, to see who would win. So what happens in society when we do that? Okay? It actually takes us into this kind of either-or model. It's either technology or the doctor. And that's not reality, because I challenge you to show me a scenario where technology plus a doctor doesn't win out. So the thesis, outside disruption does not work in healthcare. We need a new model for disruption. What does that look like? It's moving disruption from outside, disruption inside the healthcare ecosystem. Luckily, we have a Trojan horse in the system who kind of has 1 foot in and 1 foot out. Who would that be? The doctor. Okay? You know what? Doctors have historically led innovation. A great image of Banting, who just less than a mile away from here was the discovery of insulin. So doctors are great at discovering drugs and surgical techniques and devices because that's in their wheelhouse. Technology isn't. Okay? So that's one of the reasons why they've not been involved in innovation so far. They're technology laggards in a way. Yes, they use technology out the office, but it's not come inside. And of course, they're type A. They're risk averse. And of course, they also have well-paid jobs. Hard to imagine leaving a salary like that to go into a startup. And they're not familiar with that OS system that Aaron was talking about. These startups work very quickly, right? They build and they launch overnight almost. Doctors are unfamiliar with that process. So what is the risk? The risk is that if doctors don't lead innovation, that outside disruptors will displace them. But there is good news. Doctors are the ideal disruptor inside healthcare because they know that complex ecosystem. They know the connectors between the different players. They know the workflow and the pathways. And they're motivated. They know the motivations that will actually get them to adopt technology, whether it be financial, whether it be efficiency, whether it be quality of patient outcome. And the best thing, of course, is that if they discover and build these new technologies, that they can actually push them down to their patients so they get adopted into the system. So all they really need is a platform. So at Cassette Health, we're launching a new platform. It's called Hacking MD. Everyone here has heard about hacking? Not the bad hacking, the good hacking. Okay? This is what hacking is. Hacking is when you bring together lots of individuals to an event outside the ecosystem, and you give them challenges. So in this case, we bring physicians together, groups of 5. Maybe you might have an organization where you have 50 doctors, 10 groups of 5. You give them challenges, and you let them ideate away against that. And the not surprising thing is that magic comes out of it. The ideas are brilliant. And doctors, surprisingly, can actually look at problems from a patient lens and create solutions that work for patients as well. So this platform has a couple of pillars. One is the hacking. That's great. That's for creating the ideas. But then we also have an online innovation platform where doctors can go and actually watch ideas coming to life. That's very important for them to see that progress. And we also provide a set of validated innovations. Doctors have to be able to go to a place to find out all the wonderful innovations that are taking place around the world so they can actually bring those into their practice. And of course, we have to educate doctors. They need education in entrepreneurship. And we've done this in a very pragmatic, disruptive approach, meaning that once ideation has taken place, we don't require the physicians to get involved in the technology development. We take care of that within our accelerator. But we bring the doctors back in later to do testing. It's important. Once you have that solution, test it, validate it, get feedback. That allows you then to do the commercial build, and then we can bring the doctors back in again to do the launch. This is what allows us to take all the ideas that Aaron's talked about the ability to develop quickly and scale, and bring it to healthcare. But it's not just on the shoulders of doctors. You have a responsibility too. You need to demand more from your doctors in terms of technology. If you have a great app or a wearable that you're using or a great website, tell your doctor about it so you can use it with his other patients. Okay? Of course, if your doctor's not using technology at all, in the future you might say to him, get yourself over to Hacking MD. It's a place you can go to actually drive your innovation thinking. And last but not least, it is important that you continue that disruption from the outside. Not to stop it, to continue it. But the important thing is that the external disruption needs to focus on prevention. Let the internal disruption that focuses on healthcare be done by the healthcare professionals, the doctors, the pharmacists, the nurses. So the future presents us with 2 options for healthcare. Patient Richard, you have stage 4 lung cancer with life expectancy of 3.8 months. Have a nice day, and please book a follow-up appointment on your way out. Okay? That's healthcare led by technology. The other option, of course, is healthcare led by humanity. The choice is up to you. Thank you very much.
Thank you, John. You get a little picture?
Yes.
Aaron, that was great.
Thanks.
Do you specialize in healthcare, or you do this for all industries?
No, interestingly, the organizing problems exist across every industry, so it literally is for-profit, non-profit, government. If anyone's been watching the US election process, they're all broken.
Everything's broken.
Everything's broken, but everything can be fixed from within.
That's great. Let's get a picture. Thank you.
Can I move this way?
Yeah,
That's
that'd be
good.
cool.
Yeah,
Great.
thank you. Okay, we're going to try it and check it. Looks good. Thank you, guys. That's great. Okay. Thanks.
So, John, when are you going to hold that hackathon, and where?
Well, I think we're actually, so the next hackathon is going to be here in Toronto in the fall. So that should be an exciting event. Once again, inviting lots of physicians in with challenges and getting industry involved. So industry has a vested interest now in leveraging that kind of innovation thinking of doctors. I think that's the future now, really, is corporations leveraging their customers outside the organization and take their talents to bear on innovation and then take those ideas and bring them into the organization.
Is it open to the general public?
I'm sure we have physicians in the audience.
You have to be a physician. You have to be in the game.
In certain hackathons, yes. In other ones, not. In this case, we're really focusing on really pulling that expertise from inside the ecosystem because the doctors are living this on a daily basis, right? And as I said, the important thing is that doctors have that unusual capability. I didn't think it was there to really think about healthcare from the patient lens. And so they kind of bring all perspectives to it in many cases.
Well, good luck with that.
Beautiful.
Thanks very much.
This way. That's the microphone.